Ghana is one of the first countries to distribute COVID-19 vaccines via drones to the hinterlands. The symbolic COVID-19 vaccines were delivered at Asuofia, one of the communities of the Etrima and Wabiajan North District in the Ashanti region, where it is estimated that 1,000 eligible citizens are to be injected against the dreadful pandemic. About 11,000 people in the rural communities in the Ashanti region are to be reached with the vaccines through drones during the first phase of the vaccination exercise. Metro News' Ashanti regional correspondent Abdul Basit Suleiman has more.
Government in April 2019 Zipline's medical drone delivery services into the Ghana Health Delivery System. One of the key contributions of the Zipline drone services has been the use of technology to deliver emergency medication to mostly rural areas where road transportation and access to urgent health care have been a challenge. Recognizing the fact that the COVID-19 vaccines rely heavily on a cold chain which must not break at any point, the government, upon receipt of the AstraZeneca vaccines on February 24, distributed some of the doses to Zipline at Impania Drones Center near Asante Mampong for speedy and timely distribution to some hard-to-reach areas which are part of the designated health facilities in the Ashanti region. At the start of the nationwide inoculation exercise on Tuesday, March 2, 2021, the first batch of the vaccines were successfully delivered via drones at the Asuofia Polyclinic in the Atrimanwabiajan North District of the Ashanti region, with the first of the 4 consignments of the day delivered at exactly 11:17 a.m. to the delight of the people around. The health officials immediately received and kept the drugs in the standby cold storage system after a careful scrutiny to ascertain that everything was in line with of the Atrimanwabiajan North District Assembly were the first to place a request to Zipline for the drone's delivery of the vaccination, while Asuofia also falls within the considerations of Zipline in its operations, as the district has an appreciable number of rural communities but with bad road networks that could hinder their access to the vaccines at the desired time. The Member of Parliament for the area, Benito Asuofia, who is a former Deputy Minister of Land and Natural Resources, was the first to take a jab, followed by other local authorities. The MP, Benito Asuofia, shared his experience with the media afterwards.
I didn't feel a thing. And so my advice to Ghanaians is that it's just like the normal injections that we take, the normal vaccinations that we've been having, like the polio, like the measles, like the yellow fever. It's just the same thing. This is not something different. And so I am advising everyone to have this vaccination.
The Atrimanwabiajan North District Director of Health, Eric Sapon, expressed delight that his district is the first in the world to have received the COVID-19 vaccine through technology.
Most people are not aware of Zipline, and the mere fact that the people seeing the drone coming is a plus for the district. At least people ask what is happening. What is happening? We told them, of course, the COVID-19 vaccine in, and it's a very good plus for the district. Yesterday we started our training, and we have 10 vaccination centers. Of course, that's the fixed point, but because people are not aware or might not be aware initially, we'll be going to various houses as well. But in the interim, we have 10 facilities, that's both private and government facilities, and including CHAG, which we have we've cited them to be the place of the vaccination.
General Manager of Zipline Ghana, Na Adokoyosin, said her outfit is committed to ensuring an equitable and timely distribution of the vaccines to the hard-to-reach areas.
What we are doing is that we are supporting the Ministry of Health and its agencies to ensure that there's equitable access to these COVID-19 vaccines, irrespective of geographical locations. Especially if you look at the hard-to-reach areas, transporting it by road oftentimes becomes a big challenge because of the cold chain involved. But with zipline services and its support to the Ministry of Health, we ensure that there's equitable access of this product to even hard to reach areas that are unreachable by ground, while still maintaining the integrity and the quality of the product. And so